and there's a sort of icon on the left-hand side of your screen that you can do that through. You can submit them at any time during the presentation, and I will try and direct as many of those as I can to Tom and Gail at the end of the session. Just one final thing before I pass you on. If you're using the interpreter today, you'll probably be able to see those in the video boxes. I believe that you can enlarge those boxes to get a sort of bigger, larger scale picture if required. So please do that now if that would be of use. Okay, without further ado, if I can just pass you over to Tom and Gail. Thank you.
Okay, thanks very much, Barry. And hi, everyone. Really delighted to be here today to join this session to talk through a lot of the work that's going on to inspire and support people living with long-term health conditions to be active. So as Barry mentioned, I'm going to talk through a little bit around an overview of why this, is such an important audience to support, particularly in the context of tackling aspirations to tackle inequalities and some of the ambitions there. We'll then talk through an overview of some of the approaches and programs and policy pieces that are currently either happening or in train to really bring that to life for you. So, and a lot of that stuff is some great opportunities that really will shape how we work in this space going forwards. And as Barry said, there'll be an opportunity for questions at the end. And I guess I'm unapologetic for those of you that join our We Are Undefeatable webinars, which Gail is going to talk about as a campaign a bit later on. We have stolen a few of the slides on that because it's so pertinent. But the purpose of today is to really build on that and give you a bit more detail around some of these areas. So if we could, next slide, please. So just want to start with some context, and I appreciate you may have heard a little bit about some of this in the keynotes this morning, but 1 in 4 people live with at least one long-term health condition, and in real terms that's upwards of 15 million people, and that number's rising. And actually some of the latest research from the Richmond Group of Charities suggests that's as high as 19 million people living with at least one long-term health condition. So this is previously you might have considered this audience like a niche piece of work around sport and physical activity. Now it's the norm, and it has to be considered and embedded into our thinking and how we support people generally. That number rising is particularly so for people living with multiple long-term conditions, with comorbidities, and estimates are somewhere between 15–30% of the population. Having multiple long-term conditions can mean that a lot of the symptoms are magnified. The effects of drugs and associated side effects are much more complex. And all of this impacts on the individual in terms of their physical and mental health. And we also know that people facing the highest level of economic disadvantage have a 60% higher prevalence of long-term conditions, or having a long-term condition, and a 30% more severity of disease just by that level of economic disadvantage. It's really stark sort of stats we're talking about here, and that's compared to those in the least areas of economic disadvantage. And talking, I guess, bring it to life, thinking about health inequalities, and particularly for the purpose of today, for those of you that were aware of Sir Michael Marmot's review, which really shaped back 10 years ago, his publication, Fair Society, Healthy Lives, really shaped how we think about health and health inequalities in terms of the wider social determinants of health. So not just how we consider health in the realms of treatment and the NHS, but actually where we live, where we work, and the environments where we are every day play a really important role in our health. What the Marmot review 10 years on, which was published, I think, in February this year, told us that health inequalities are widening. So with all of the investment, with all of the work and the focus on this work, this is still a really challenging area. It painted quite a grim picture, particularly in terms of life expectancy and healthy life expectancy, so the number of years you can expect to live in good health, particularly stark between the most and the least affluent communities. There's a widening north-south divide. For women living in the most deprived areas, life expectancy actually fell for the first time in decades. In short, the amount of time people spend in poor health has increased since 2010. So I appreciate, it's not how I want to start a presentation, giving you some stark and grim stats, but it's the reality of the world we're in at the moment. And when we look at healthy life expectancy in London, and of course, many of you down the line will be very familiar with this. I'm taking some of this data, and I was looking at the data. I was looking at this last week on the Public Health Outcomes Framework data. You can expect to live for over 13 years longer in better health, depending on where you were born and grow up in London. 13-year difference. It's amazing when you think about it. And I guess from a Sport England strategy perspective, and many of you were on the line listening to the keynotes this morning, and this will be a theme running throughout the conference, is, you know, we're really excited that Sport England's going to be launching a new strategy early next year, 10-year strategy, which really positions tackling inequalities as a core ambition. So really pertinent to today's discussion. You know, this is still being finalised, and we know there's been lots of discussions with many of you down the line, and those discussions will continue. We really are keen for this to be a co-designed piece of work that doesn't feel like it's a static piece of work when it's launched. It's going to continue to grow and evolve, because it has to over a 10-year period of time. And we've seen just over the last 6 months how much can change in a short period of time. So some really big opportunities, I guess, through the strategy. And I'm going to finish this final bullet point on a real positive. So some of you may have seen, and this is available on the Sport England website, the latest social return on investment document, which is the first of its kind, published by Sheffield Hallam University, states that sport and physical activity contributes a £9.5 billion saving to society through improved physical and mental health as part of the prevention of long-term conditions. So as whilst we're talking today about how do we support people living with long-term conditions, actually the role that we have in terms of preventing it is hugely valuable, not just to the individuals, but to society as a whole. Next slide, please. So I'm just going to talk quickly through what some of the challenges are for people living with health conditions, and some of the impact that COVID-19 has brought. Barry touched on a bit of this. Next slide, please. So we're going to start with the Active Lives survey. Now, I appreciate many of you will be familiar with the Active Lives survey. It's the biggest sort of physical activity surveillance program we have in the country. It's held in very high international regard. And we have two publications of, or the publication of data is twice a year. So this data we're looking at is from November 18 to November 19. And I think next week or the following week, a new data tranche will be published. And this is where you can delve deeper into your particular local authority or cut the data by different demographic groups. So this data doesn't take into account COVID. So I think it's important to say that. But what this slide shows is the difference in activity levels between people with a disability or long-term health condition and those without a disability or long-term health condition. And what that shows quite clearly is you're almost twice as likely to be inactive if you live with a long-term health condition or disability than you are without. So you're much more likely to be inactive because of a range of barriers and perceived or actual barriers, and we can come on to some of those. But I think it's really important that we actually see that almost or coming up to half of people living with a disability or long-term health condition are already achieving the CMO guidelines. They're achieving that 150 minutes a week. They're finding ways to be active that work for them. Now, that's still significantly short of the proportion that don't have a disability or long-term health condition. But I think as we talk about common ingrained thinking and perceptions that we have, we do tend to think people with health conditions, are an inactive audience, and we hear that quite a lot. And obviously, as this shows, that's not necessarily the case. So the challenge we've got is how do we make activity work for the proportion that are inactive, and see the same benefits as those that currently are active. Next slide, please. So digging a bit deeper, what the Active Lives survey shows us is that, and what this slide on the bottom right-hand side shows, is that the more impairments you have, the less likely you are to be active. So as you can see there's three different lines there that represent whether those individuals completing the survey say they have 1, 2, or 3 impairments. And unsurprisingly, those individuals that live with 3 or more impairments are much less likely to be active. But really positively, what we're seeing, and this is a trend, a statistically significant trend over the last couple of data sets, the last couple of years, is that those people living with 3 or more health conditions that proportion of being active is increasing. It's slow, but it's there, and that's really important. So we need to understand that, and we need to understand why, and support others in the same way. Next slide, please. So in terms of COVID, and I appreciate this might have been touched on by colleagues from Public Health England earlier on, but we've got as part of the keynote. But if you look at physical activity levels across the pandemic, for those individuals that stated they have a long-standing condition or illness, we know there are significant challenges to being active before the pandemic, particularly so during the pandemic. And what this graph shows is that for those individuals, and they were asked, how often you're undertaking 30 minutes or more activity across the last 5 days. So for those across the last week, sorry. So for those individuals that have said that they've been doing that for over 5 days compared to those people that have said none. So essentially what that red line shows you is fairly consistently throughout the pandemic, there's been a fairly high proportion of this audience that have found it very, very difficult to be active. Particularly so in those dips in May, I think, where perhaps the cases and the deaths as a result of COVID were at their peak. But I think what I really want to draw your attention to is this green line, and this is a real challenge for us collectively. Is that if you look at the beginning of the pandemic, 29% of this audience say that they were achieving activity at least 30 minutes on 5+ days a week, and that has dropped to just 23% come the latest data set in September. And what that really is telling us is that for those individuals with a more resilient habit, actually they've struggled some of the most to keep that up. And I guess that's because the normal ways of being active have been disrupted, haven't been able to attend the things that you would normally attend. This isn't just for this audience, this is for all of us, but we thought I'd paint the picture in this graph. The next slide, please. So it's not just quantitative data, it's not just the numbers we're talking about, it's the qualitative, it's the impacts on the individuals as well. And some of this research has been undertaken as part of the We're Undefeatable campaign, which Gail will touch on a bit later on. But it paints a really this is talking to individuals with lived experience, with a range of health conditions, a range of severity of those conditions. And it paints a really stark, unsurprising picture of the impact on the audience. Heightened anxiety, sapping people's motivation, that roller coaster of feelings, fear surrounding the lockdown easing, and the confusion around some of that and how it's been handled. The need for reassurance and what the safety of that means. A wariness regarding the reopening of sports facilities. And you can see under there, not just a lack of the trust in the implementation of guidelines, but it's about the behaviours of other people that this audience is particularly worried about. So it's very easy to think, actually, we need to throw information at this audience and to people to say what you can do rather than what you can't. But as that bottom box shows, people are feeling really overwhelmed by information overload. And it's really difficult for every one of us. I think we've all been confused at one point with guidelines and what it means and trying to interpret it. So for people that are already feeling the barriers about being active, you can have that information overload. And that's really difficult, because that means it's a really difficult balance to strike around how you get the amount and type of information right and how you get it out there. Next slide, please. So building on some of that research, as the top of this slide shows, 4 in 10 people with a health condition say they're doing less physical activity since the outbreak. So whilst we can see on the left-hand side there, 28% say they're doing more and perhaps finding different ways to be active. And that's a real positive that we need to keep hold of. Unfortunately, that 41% are doing less. And this is a real challenge. And I guess that echoes some of the graphs we saw earlier on. And I think in the red box there, as it shows, 45% of this audience say that they worry about leaving the house to do exercise, to be active, because of, I guess, the fears and the anxieties that are there. And that's really worrying. And so, I think there has been a big drive to try and support people to be active in different ways that you can do in the home. And Gail's going to pick up a bit of this and how we've done that through We're Undefeatable a bit later on. Next slide, please. So I'm just going to touch on, albeit very briefly, some of the common perceptions and ingrained thoughts that we often hear. And all of us, I think, have heard these once upon a time. So next slide, please. And these are for illustrative purposes only, and they are the extreme end, but we're trying to paint a picture. We hear that rest is always best for people with health conditions. And of course, whilst rest is an absolutely integral part of the management and treatment of long-term conditions, it's got to be balanced against the conveying of messages that say and talk about the evidence that being active can have on people's conditions. So actually, yes, rest is important, but so is being active. For all of the different ways we know around the symptoms around fatigue and pain management and many of the symptoms that people with long-term conditions face, it's really important. We often hear that people living with a health condition should only be signposted in condition-specific exercise. And it's really important to say condition-specific exercise, whether it be, and we hear this, whether it be cancer or type 2 diabetes specific, and you're doing it in groups with specialist instructors, really, really works and is valuable for a range of individuals, but it's not necessarily right for everyone. And that's the point we're making here. All people living with a health condition should and want to seek expert condition-specific advice. We have to make that advice available. We need to make the information available, and we'll touch on that a bit later on. But many people, as I'll come on to, are very absolutely able to self-manage, understand their condition better than anyone else, understand what they can and can't do, and perhaps just need a bit of motivation to become active. They don't necessarily need to go and find that information, albeit it needs to be there. That all people living with a health condition are one group. They're a homogenous group. We hear that a lot, and therefore need to be treated in the same way. And of course, every individual is different. Every long-term condition is different, and the symptoms that people face is different. So treating people as an individual is the fundamental way forward in that person-centered approach. And then the final one there, providers of activity, any activity, must have an in-depth knowledge of health conditions and the qualifications that demonstrate that to provide a really positive experience. And I think what we're saying is, of course, for the workforce, and we'll come on to the workforce a bit more, that want to specialise and want to understand more about health conditions, that pathway needs to be there. But we can't, it would be impossible for the entire physical activity frontline workforce to be specialists when it comes to long-term conditions. What we want to do is make sure that the information is there and there's the right conversation with the person in front of them that enables the best possible experience. And we need to work through, and I'll come on to this, work through what that looks like, but that's the most important thing, that person-centered approach. Next slide, please. So what this diagram has been taken from the NHS long-term plan, and this might be familiar to many of you. This is their comprehensive model of personalised care, and this really shapes about how we support people to self-manage. And what this effectively shows is the different levels of support that individuals might be. It's a crude way of looking at it because everyone's different, but it's effectively a sliding scale. So what you've got at the top of the pyramid there is that the NHS has defined that about 5% of the population are considered to have complex needs. These are people and individuals that are having very frequent and regular touch points with perhaps a range of health and care professionals. There's lots of supervision required, and there are not lots of support, and that could be across health and social care. And of course, physical activity needs to be embedded into that through those secondary care pathways, through the conversations that clinicians have with the individual in terms of how you can build it into those lives. So the physical activity has to be there. We're seeing examples of this up and down the country of how and where it can be embedded, and the best times to talk about physical activity for different types of health conditions and for different individuals. The middle layer of the triangle there, 30% of the population, people living with long-term health, physical and mental health conditions. And this is the audience we're talking about really today, particularly so, and through We're Undefeatable. And this is about supporting people to build the knowledge and the skills and the confidence to live well. And I guess empowering them to make decisions, and ideally to support them to be active and understand the value that physical activity can have for them, I think is integral. And of course, there's lots of nuances within this 30%. Some of these individuals will require specialist support. The majority will require more levels of motivation to become active. And of course, along the bottom there, you've got your whole population. And we're talking about, this is where your sort of health prevention approaches come into their own. And actually, how do you reduce the risk of health conditions that we know physical activity can do? How do you delay the onset of them? How can you reduce the severity of health conditions? So this is a sliding scale down here, and an individual can slide in and out of each of these. But I thought it'd be useful to sort of show it in this way. Next slide, please. So I'm going to move on to some of the thinking, the whole system thinking, and some of the approaches that are currently in train. This isn't everything. This is a snapshot of the work that's going on that many of you will either be familiar with or might be able to better utilise, that can support an individual to become active. Next slide, please. But in order to stimulate system change and a whole system approach, we need to change social, cultural, organisational norms. And that means changing the attitudes and the motivations of people living with a health condition. And this is where We're Undefeatable comes in, that Gail will touch on. We need to make sure that the individual, the networks around that individual, the daily messages they receive are delivered from a range of different sources. And those opportunities and those messages, and that could be carers, could be the family members and friends, healthcare professionals, it could be what you see and hear in the media. But this is about that those messages need to be, first and foremost, there, and about physical activity, that they need to be evidence-based and they need to be appropriate. But they definitely, you know, but there's an opportunity to challenge some of the misconceptions and some of the ingrained thinking. So we need to shift the messaging from what you cannot do to what you can do, and feel empowered to be able to do that. And then finally, on the right-hand side there, this is about opportunities to get active in a way that's right for the individual. This isn't about pigeonholing people down a particular pathway. This is about working with them to understand their needs holistically and support them to find what's right for them and to have a great experience of that, whether that be walking around the block, whether that be joining a very specialist session. It's going to be different for everyone. Next slide, please. So this slightly complicated diagram shows some of the ways that we collectively are activating system change. So what you've got along the top there in the bluey lilac-y colour is some of the ways that, you know, what we want individuals to see and feel, basically, you know, to feel inspired, to be motivated and supported to be active. And we look at this through a COM-B model. So many of you will be familiar with COM-B, but this is around an individual's capability, the opportunities there, and levels of motivation. And if you can actually get those three things right, you stand a much better chance of changing their behaviour. So we want an individual to feel inspired, I guess, to see things and to be inspired by it. This is where the campaign comes into its own. If they're in touch, we know many individuals and the health charities, which Gail will come on to, you know, millions of touch points a year with individuals living with health conditions. The physical activity has to be embedded with the charities. It needs to be reinforced by healthcare professionals, ideally at every point, but we recognise the challenges there. That it needs to be discussed with the social prescribing link workers, and we know there's a real, for those of us been involved in the sector for a while, social prescribing is not new. It's been around for a long time, but there's a real spotlight on it at the moment and a lot of investment behind it. And so it is an opportunity to bridge a lot of these conversations. But also we want that individual to have a great experience of getting active. And what this pinky colour along the bottom is some of the enablers that are currently underway or that have been developed to support those things above. And we'll touch on these things next. So for next slide, please. So we'll start with some of the work that we do in partnership with Public Health England to support healthcare professionals. And I guess our main programme to support this is the Mowing Healthcare Professionals Program. So it does what it says on the tin. So I guess there's a few different strands to this programme. One of them is around training healthcare professionals, and we I think we've got something like 47 clinical champions, so clinicians across a range of disciplines and expertise and specialisms who are trained up to be physical activity champions and then going and delivering training to their peers. And that training traditionally has been face-to-face. It could be a part, if you're looking at primary care, it's part of protected learning time as an example. And it's an opportunity to, and we know that clinicians are much more likely to listen to other clinicians rather than the likes of Sport England. And I think these are the sorts of things where we need to put our hand up and say we're not best placed to do this, but we absolutely want to see this. And I think something like over 26,000 clinicians are attending this type of training so far. So we're starting to get some real scale, and there's still a lot more to do. There is lots of resources and CPD resources that all of us can go on, not just healthcare professionals, but we really want to bring this to life with healthcare professionals. There's the Moving Medicine platform, and it's a website that goes into a range of advice you can give to individuals across a range of different types of health conditions, and it gives you lots of condition-specific advice if you're a clinician. But it also gives you what are those key messages to give a patient where you have very limited time, and we know time is such a challenge for our health professional colleagues. So if you've got 10 minutes, if you've got 5 minutes, if you've got 1 minute, for instance, what are those key messages? And that's what some of these resources look to do. There's lots of e-learning across the BMJ or Health Education England that people can access. There's a real drive to upskill the next generation of clinicians and doctors. And so we're looking to work with, well, we are working with medical schools and schools of health to give tailored site-based support to embed physical activity into how they learn. And this is something we're still testing to understand the impact of and understand what scale could look and feel like for this. And I guess the final strand there is looking at secondary care, active hospitals, undertaking a pilot working with the Oxford Hospitals NHS Trust that isn't just about physical activity and care pathways and the advice. It's about what does it mean to build physical activity into the culture of how a hospital operates. And what do we learn from that? And how can you transfer that to another hospital setting? You know, what's been really effective? And those ingredients, if you like, we're trying to pull out. Now, if anyone wants more information around the Moving Healthcare Professionals Program, I mean, these slides will be circulated, I'm sure, afterwards, and you can click on and you can follow the email address there and get some information. We're also working closely with the Royal College of GPs, who amazingly have prioritised physical activity in the work that they do. So they've developed a physical activity toolkit, and they've also, one of the key things they've got is the Active Practice Charter. And this is a commitment, if you like, for a GP practice to support both staff and patients to lead less sedentary, more active lifestyles. So there's a real drive, and we're seeing up and down the country again, different ways that we're encouraging practices to sign up to this, embedding it into the contracts with their CCGs as an example. Next slide, please. So one of the key areas of work that's really going to underpin actually a lot of the work that we do is the consensus statement, excuse me, on risk, or on no or low risk, as we're increasingly calling it. And this is a piece of work with the Faculty of Sport and Exercise Medicine and the Royal College of GPs again, to develop a consensus on risk that provides reassurance to healthcare professionals that it's safe to, excuse me, encourage, empower, and motivate patients with long-term conditions to be more physically active. And there's lots of progress being made. There's a systematic review of the evidence. Lots of the statements have been drafted that revolve around the symptomology rather than the condition-specific type advice. And they're currently at a second stage, what's called Delphi panel, which is testing this with a range of healthcare professionals, different disciplines and different levels of expertise to understand, actually, are we getting this right? And those final statements will be developed and published in a journal. And there's lots of work to activate these pieces around risk. Next slide, please. So why are these risk statements so important for what we do and how we work? And I guess for everyone down the line, what might it mean? So alongside reassuring healthcare professionals, and I should say, because we are quite a risk-averse sector, you know, I think the fear of liabilities and the fear of an adverse event or effect on an individual from being active, there's a real sense of actually that could come back on the person that's referred them, or the person that gave that information, or the person that's delivering the activity. And we need to stop treating everyone with a health condition as very high risk, as we've sort of gone through already. So this is some of the work that's doing that. So not only is it for healthcare professionals, it's around information to patients regarding the concerns they have about exacerbating symptoms, the chronic pain and fatigue. It's going to form the basis for conversations with the Department of Health and Social Care around the medico-legal implications of this and the policy statements and charges. And you may be aware that for actually many individuals that are signposted or pushed back to their GP to get approval to be active, and this is happening, it is within the realms and the rights of that practice to charge a fee to provide a letter to that individual, up to something like £60. So you just think about the number of barriers that are there for that individual that may have taken those first steps into activity, that they can't attend the activity, they're pushed back to their GP, and then they're being charged. And it's not necessarily that level of charge, but we are seeing charges up and down the country, which really is something we need to address. It's going to form the basis of conversations with the sport and physical activity sector insurers around risk management and triage for long-term conditions. And of course, it's going to link to the workforce, which I'll come on to next. So next slide, please. So we're doing a lot of work with UK Coaching at the moment, who are a strategic partner of We're Undefeatable. And they developed a We're Undefeatable workforce guide that started to around, I guess, what are the types of behaviours you need to employ as a frontline coach to support someone with health conditions. And at its core, it is about really good customer service. But they're looking to starting to scope a more comprehensive learning and development pathway for the broader workforce, physical activity workforce. So not necessarily the specialists who have very high levels of qualification, but absolutely for the broader workforce. But it could be open to anyone. And this pathway is going to be based on really positive behaviours, being person-centred. It's going to be about inclusivity and accessibility, but it's going to be overlaid with long-term condition insight that we're getting through We're Undefeatable and elsewhere, and the information there. If you're a coach, it will help you understand where you can go for more information if you have someone turn up to your session with a particular condition who may need a bit more support. And it will be aligned to those SIMS standards that we know exist. This hasn't been written, this is an ambition. So the UK Coaching will lead this piece of work, but will undertake a significant piece of wider engagement to co-design what this pathway looks like and how to bring it to life, how to activate it. And of course, this piece of work will align with the work around risk. Next slide, please. So my final slide, you may be pleased to hear before I pass across to Gail, is talking about, there's lots of information there. There's a whirlwind tour of some of the work that is going on that doesn't even take into account all the stuff going on the ground and the things that are being tested locally. But the hashtag easier to be active, which meant some of you might be familiar with, was a way, an ambition to pull all of this together into a coherent framework that all of us, whatever our roles and responsibilities and wherever we are in supporting that individual on their customer journey, can support them in different ways. But there has been a demand for a framework that does this. And this is the starting point for that piece of work. So we're working with the National Centre for Sport and Exercise Medicine at Sheffield Hallam University to lead a lot of this work, but obviously working with everyone in the sector. So phase one, it was always around going out and understanding, and you can see the questions there, you know, what could be done differently to make it easier for someone with a health condition, how an organisation or individuals adapting their activities, particularly during COVID, and any other ideas to improve the experience to someone with a health condition. And this is really starting an opportunity for everyone to feed in their thoughts and their expertise. And we had over 1,100 different types of contributions. And those on the right-hand side of the slide there, the key findings from phase one tell us that, you know, we need to do more around intrinsic factors to motivate individuals. We need to be clear who the key actors are, the people, the networks around the individual. The pathways and referrals are really important, but what should they look like? And how do you design services so they are person-centered and do support people to be active in a way that's right for them? But you can't do that unless you get the messages right and the marketing and comms. And of course, none of this is possible without a culture that sport and physical activity is integral to how we operate. And obviously to do that, you need that integration and collaboration across the system. So this is sort of phase one key headline findings, if you like, that need to be explored further. And phase two is going into more in-depth qualitative interviews with a range of partners. And then ideally, there will be a set of opportunities and solutions that can be tested more widely, and there'll be opportunities for everyone down the line to do that later in autumn. But you know, ideally, this is quite an iterative process to find out. You know, Gail and I don't come with the answers today. We're coming with a range of different tools and resources that can be utilised, and they'll be utilised in different ways by different organisations and in different places. But there's still a lot to do. So without further ado, that's my slides, whirlwind slides, coming to an end. I'll pass over to Gail to introduce herself and talk through a really exciting campaign, We're Undefeatable. Thank you.
Thank you, Tom. I hope that everyone can hear me okay. My name's Gail and I work for the Richmond Group of Charities as Physical Activity Campaign Coordinator, which involves coordinating the relationships with the charities. And there's a couple of areas of work that we focus on. One is the Movement for All programme, which is a number of Sport England funded projects across the charity group. And the other is the We Are Undefeatable campaign, which I'm going to talk to you about today, which has been developed in partnership with the charities and with Sport England. Next slide, please. So the Richmond Group of Charities is a collaboration of 13 health and care charities supporting people with long-term conditions to live well and to get the help that they need when they need it. And the shared programme of work that we've been focused on looks at increasing activity, including peer support groups running physical activity sessions and helplines being used to support people to be active via telecoaching, for example. Other Richmond Group programmes include the Multiple Long-Term Conditions Task Force, who have published research and a guidebook of good practice. And then on this campaign, we're also working with Mind and Parkinson's UK as charity partners. And we are also maximising the reach of this campaign by working with other partners such as Public Health England, as Tom said, UK Coaching and Active Partnerships. And our aim with this campaign, We're Undefeatable, was to understand our audience and to create a unified voice about activity and look to reframe the narrative based on what we've learned. So we launched a 6-week campaign initially in September 2019, harnessing the channels of the charities to reach millions of people. And what was the main reason for this campaign? Well, it was that physical activity can play a powerful role in supporting people with long-term conditions. For example, the quality of someone's life, their ability to function well as they get older, helping them to live well as long as possible, and even delaying or preventing development of multiple long-term conditions. So this campaign was tested extensively with the target audience using sources of research and insight, because it was so important to the group that the campaign was representative of all conditions, but not condition specific, that anyone with any condition could identify with and be inspired by the films and the messages. Next slide, please. So these are the key themes that shaped the campaign. It was really critical that we understood the barriers that people faced. So we conducted several focus groups to learn about how to talk to people differently about being active. And some of the key points were, for example, being active in everyday life compared to being sporty works really well as a message for this audience. So we look to build a rapport with people by depicting their everyday lives and fitting in with their particular lifestyles and differentiating from sportswear brands, and really driving a sense of support and enablement with this audience. We also tried to find a balance between positive and negative imagery, because that can have the ability to motivate or potentially demotivate the audience. So it was essential to acknowledge that sometimes people struggle or they can't do things quickly. And overall, the tone of voice and the visuals needed to dial up the positive, celebrating the smallest achievements, but not ignoring the others as well. Inclusivity drives a real sense of belonging, which helps motivation as well. So social interaction was a strong pull for this campaign, and that clear targeting would help, such as visual shorthand. So showing a scar underneath a t-shirt or showing someone using their inhalers. That was all really important for getting that audience visible. And that the goals and the activities that we showed were realistic. So we had to create a sense of attainable, sustainable activity. Next slide, please. So hopefully we're going to be able to show you the latest television ad that's currently running. If you could play that, please, if it's possible.
That's life, and as funny as it may seem, some people get their kicks stomping on a dream. But I don't let it get me down, 'cause this fine old world, it keeps spinning around. 'Cause this fine old world, it keeps spinning around.
Great, thank you. Hopefully you were able to see that. That's the television ad. If you could go to the next slide, if you can, that would be great. So it's important to mention, while we're looking for the next slide, that none of those people are actors. They are all people with lived experience of a variety of conditions who were filmed especially for that advert. Hopefully we'll get back to the presentation in a sec. I'll carry on talking about some of the emerging themes that have come out since COVID-19. So we've continued to explore with our audience how they're feeling and how they've been affected by COVID-19 and the outcomes to their physical activity and mental health. Obviously, Tom has told you a lot about the levels of activity. We've found that, as he mentioned, that heightens anxiety really saps motivation. But the campaign continues to play a role in acknowledging those mental health challenges. That there's a need for solutions that are tangible and straightforward and easy to access. So it was more important in this phase for us to be a little bit more prescriptive with our audience. So we looked for practical solutions such as producing a leaflet, which I'll mention in a bit. As Tom said, concerns around safety when doing physical activity have really come to the fore recently. And so we have looked at creating some resources that help to support that. And our charity partners really can reassure on safety as trusted experts. Support to build a daily routine is really important. The motivation to maintain that is really important. And the key to this is resilience, but it is one of the biggest challenges. So we've looked at how we can help support that. We've produced a digital tool, which I'll mention in a bit as well. And what's been really great to hear is that the campaign is more relevant than ever. So the overarching theme of the importance of physical activity has continued to resonate. It's been a positive yet calm tone of voice, which has been welcomed in this context, and it's been seen as realistic and heartwarming. Next slide, please. So we've looked at adapting the campaign since throughout the spring and summer to feature obviously in the home or around the home activities, and we've mainly used the existing footage to do this. But as the summer approached, we had to look at generating new content. So we looked to ask users to generate their own content. People such as Tommy in the first picture there, who's living with dementia, who made a golf target in his back garden using an old duvet, which was useful in keeping him active. And Mahesh, who took up yoga during lockdown to help manage his diabetes and help keep him active. It's really important to continue to show a range of ages and abilities and settings and activities to make sure that the campaign remains as inclusive as it can be. And during that time, we also developed new case studies, which I'll talk about in a sec. Next slide, please. So we quickly developed some new resources to help support people during this time. We were very aware that there was a large proportion of people who were not digitally engaged, and so made extra guidance on how to get active. So this included us producing a leaflet, of which 230,000 copies have been distributed in key areas throughout England, including supermarkets in the northeast and northwest, and also through activation areas and active partnerships across the Midlands, southwest, and other counties as well. We are looking to continue to distribute this leaflet actually because it's not COVID specific, it is focused on home exercise. There's a leaflet featuring our case studies and also a pull-out poster which gives ideas that people can do at home. So it's suitable going into winter if that is of any interest to anyone wanting to distribute to their networks. We've also produced a range of YouTube videos, some condition-specific ones developed by the member charities, but available for all levels of activity and categorised by level of activity as well. And then we've produced a chatbot on Facebook Messenger, which works to prompt and motivate people to get active. And then alongside that, some basic activity ideas in the form of a suite of bite-sized movement ideas called 5 and 5. The idea being that you can get 5 different moves into 5 minutes and they're suitable for everyone. Next slide, please. So even though we had featured several people with a variety of conditions in the original campaign, we did need to look at recruiting some new case studies that had stories to tell that would be appropriate to the time. So by reaching out through our partners, we found some amazing additional people. So we've got Paul, who had Parkinson's, which is not a condition we'd featured before, who made the most of his garden and outdoor walking during lockdown. Ela, underneath him, who with the help of her daughters and some tins of beans is very active at home. Darren, sorry, moving around the screen, Darren with his dog there, who cleverly adapted his shed to include a gym to manage his diabetes and arthritis. Tommy and Mahesh, who I mentioned before. And then Linda, who is our first case study, who not only lived with her own conditions, but also cares for her husband, who has several conditions as well. So the home-based focus of that ensured that the campaign continues to be relevant into autumn and winter. And we feel that the combination of the filmed content and the user-generated content really captures a sense of real life. And the diverse group that we have there really broadened the appeal to audiences who are more likely to be experiencing the adverse effects of COVID-19. And on the next slide is some of the insight that we're gaining from our qualitative and quantitative research. So we're finding that people recognise the charities as a trusted source of information, and that can lead to them feeling safer taking part in physical activity. We're learning that over half our audience is keen to be more active, especially people living with cancer, heart conditions and diabetes. That the campaign is resonating more now with older people, those in lower socioeconomic groups, BME audiences and those shielding. And those same audiences are seeing these case studies as people that they relate to, and they're identifying themselves in a high profile situation, possibly for the first time. And importantly, those who had their motivation most affected by COVID were seeing this campaign as an inspiration and an influence to get more active. Next slide, please. So what's next for We Are Undefeatable? Well, we're currently on television until the end of the month. We've got prime spots on Channel 4, ITV and on demand. So please do look out for that. We are continuing to push out our suite of digital assets, social media messages, and to encourage our partners to share. That includes the charity channels and those of our local area partners as well, who are amplifying the campaign, ensuring it reaches the audience that we need to. Next slide. These are some examples of how the charities have amplified the campaign using their social media channels and website content. And we're finding also that the charities are using the campaign to help embed the message of the importance of physical activity into their wider work and across their organisational objectives as well. Next slide. And just a final couple of slides on how we evaluated the campaign. So we have regular quant and qual tracking questionnaires after each media burst that is ongoing. We have a community of qualitative interviews, and we've stepped that up this year to keep in touch with how people are doing during COVID-19. And then obviously we track our media coverage, viewing figures, and the website and social media analytics. We also conduct regular surveys with charity partners, and we collect data from their channels, and we're talking to policymaker stakeholders as well. In the sampling, we've recently upweighted on ethnicity and socioeconomic status to make sure that we're speaking to as many diverse backgrounds as possible in both the quant and qual groups, and that includes people with multiple conditions as well. Next slide. And these are just some key results from the evaluation of the launch a year ago, highlighting the recall and the action taken as a result of the campaign. So you can see that there was a high understanding of the message and a good level of recall. But almost half took an action as a result of seeing the campaign, which is good. And 13% started an activity, while 60% restarted an activity. And it was really important that our messages really did land well. And you can see in the box there some of the words that people were using to describe the campaign. Mostly, well, on the whole, positive and empowering. Next slide. So it's obviously fantastic for us and for the campaign and for people with long-term conditions to have your support for the campaign. And we have a dedicated area of the website that has a number of resources that can help you, such as these listed here, how to get started, brand guidelines and so on. All our research and insights are on there too. We've got various webinar slide decks and obviously all the assets, social media assets. So you can log into the website, you can sign up to our newsletter as well, which includes invitations to the webinars. Some examples of how organisations have supported the campaign so far is finding local case studies to make the campaign come alive and relevant to your local area. using our campaign narrative to update how you talk to a long-term condition audience about being active, and then the assets and imagery can really bring that to life as well. And there's guidance to using all these resources on the website too. Next slide. You can also work with your local healthcare professionals and encourage them to access the campaign assets from the Public Health England Campaign Resource Centre. So we've got a number of resources that can be downloaded and used there. And then you can also signpost coaches, volunteers and staff to the UK Coaching website. And you can look at the insight pack on the website to see how to support that audience further. And that is all from me. These are the last slide just shows our contact details should anyone wish to get in touch with us. Thank you.
Thank you, Gail. Thank you, Tom. That was fantastic, incredibly comprehensive. A lot to think about. I did have some thoughts, but I'm conscious of the time, so I just thought I would do maybe some quick fire questions that have appeared in the message board rather than the Q&A function. That's always the case. The first question's from Steph. She says, for those that attend specialist provision, how can we as the sport and physical activity sector best ensure smooth transitions to community-based general provision to ensure people stay physically active after finishing specialist interventions? I suppose this talks to the sort of local physical activity offer, and that's a general point about how do we best link that to maximise the campaign itself. Just wondered if either of you had any thoughts on that one.
Shall I go first, Gail? It's a really good question. I actually think it's an age-old. It's a question that's been around for quite a while. How do we link the different types of pathways to the provision, the local provision? I guess there's a few things for me. There's something about how do we ensure that the individuals supporting as part of specialist care pathways, for instance, are talking about physical activity, and throughout that are providing the required level of motivation for that individual. So you're right, some of them are quite time bound, some of those specialist pathways, and there tends to be, physical activity needs to be a golden thread. That sort of goes without saying, but we know often there's a review meeting at the end, and there needs to be something around what the next steps are. And often I think we're aware this is different from different NHS trusts, that we see a different approach to this, but generally speaking, where there's the most success is there. It feels like a seamless, frictionless pathway between specialist provision and being referred into a community-based support mechanism. That doesn't necessarily mean a club or a session directly, although that can work. It might be now the role of into the social prescribing link worker. It might be into local lifestyle, sort of public health CCG funded lifestyle platforms. Is there a local activity finder? I guess we can't forget that individual might not just be about group provision. They might just go and walk and cycle more, and that's what works for them and their condition. I think it's really important we get the feedback loop right, so that their GP, or wherever those sort of review meetings are held, physical activity is part of that feedback. So I'm not sure it answers your question, but it's almost like what more can we do? I guess it's making sure that we understand if there is a referral come through. I guess there is a understanding their needs when they come along to a session, giving the time to that, and being able to adapt your session to meet their needs. That kind of feels like what but it's not a silver bullet, because I think every local landscape will be different. Yeah.
Gail, anything you want to add to that?
No, not really. I think that was fairly comprehensive. Just, I suppose, always thinking about the charities, what they have to offer as well. So obviously that's very dependent on the condition, but there's a lot of advice out there directly from them.
And I just wonder if the sort of scale that the primary care networks work at might be a kind of manageable geography to look at how we sort of better link some of this stuff up as well. Next quick fire question against the clock. What age range is the intervention aimed at? Would it include children with long-term health conditions?
The campaign is mostly aimed at adults, although we do obviously recognise that some of the charity beneficiaries that we work with are younger people as well. We are at this stage of the campaign, I would say is mainly targeted at adults, and their families, you know.
Yeah.
Discount that.
There's a family dimension. Next question. What training is there for volunteers to be able to run something suitable for people with long-term health conditions? I suppose that touches on some of the stuff that you were covering, Tom.
Yeah, training available for, I mean, I guess it's not just for volunteers, it's to anyone that's interested, but a couple spring to mind. You've got the Activity Alliance run their inclusive activity program, and that's if you are leading sessions directly, it's about how to be able to adapt your session accordingly and in practice to support what might be a range of people's needs. So I think there's something very practical there. And we get, there's lots of very strong feedback. And the other one is the MIND training, the mental health awareness training for sport and physical activity. Because for me, I guess those two provide a nice balance between understanding that, and we know that you're much more likely to suffer from mental ill health if you are living with a range of conditions. So mental health is an underpinning piece, absolutely. The inclusive activity program in practice.
Great. Okay. Just conscious of time. We did start a bit late, so maybe one more question. This is from Christina, who's asked about has Sport England with PHE discussed PA physical activity benefits with the DWP? I'll stop there because it's quite a long question, but I suppose there's a general takeaway from us there.
There have been conversations, but certainly I know Tim, our CEO, and our disability lead have had conversations with the minister previously. Those conversations continue, but I guess is the question to do with the risk to benefits. Yeah. Okay. Yeah. So this has come up quite a lot. It's a topic that continues to be discussed. I don't have an answer, but okay. It is being discussed.
And just to add, Christina, there's also some pilot work that's going on through the Healthy London Partnership, focusing on a number of areas of London, looking at that closer working relationship, which we can sort of provide more details on if you want to get in touch sort of separately. Okay, just conscious that we've reached sort of time, so I don't know if we go off air just suddenly, so I'll wrap it up there. But just a massive thank you to Gail and Tom for pulling that together. What a really fantastic session. So a sort of virtual round of applause, if you can possibly hear that in your respective sort of living rooms or rooms. And if there's any sort of further questions that arise, please just get in touch with us. We'll obviously share the slides, and thanks again for joining us at the session. Thank you.